he was just really, really tiny.
You wouldn't believe it today, but little Roosevelt weighed less than 1.5 pounds at birth, 3 months premature. His airway not nearly developed.
We're talking tiny. The size of a person's airway is about the size of their little finger. So if you can imagine how small the little finger is on a baby who weighs 1.5 pounds.
Dr. Brian Barkmeyer and his neonatal intensive care team stabilized the child, Roosevelt surviving on a breathing tube. But when efforts to remove the tube failed, Roosevelt faced a potentially dangerous tracheostomy to open his windpipe. The alternative, Dr. Soet Kanotra, could perform a cutting-edge procedure with a name longer than little Roosevelt, laryngotracheal reconstruction surgery.
He said that he thought he had a good chance after reviewing, his case, and he said, I would rather do that than to go directly to a trach. So he said, well, just do it, and, I think he has a good chance.
So for Roosevelt, we actually, for the first time in this hospital, in such a small baby, tried a surgery in which we reconstructed his airway, meaning we took a part of his own cartilage and basically widened his airway using his own cartilage. Okay, boo-boo. Hello? Hello?
Now, all but healed, Roosevelt is doing really, really well. The tiny graft in his airway, a mere 3 millimeters, but it increased his ability to breathe 20-fold.
He's feeding off the charts. He's like amazingly. That's what the mom is saying. He's feeding. So his feeding is good. He's maintaining his growth chart. He's breathing properly. We're just going to take him for another look in the airway next month, and that should be pretty much it for him.
He has a lot of personality, a lot of little attitude already.
For Tiffany and Roosevelt, the first 7 months of his life have been a tough road. But the kid's a fighter, and all along the way, the doctors and nurses at Children's Hospital were there.
They were absolutely amazing, through the whole process. All of the nurses, when we left, we were it's kind of like we're all like one big family. So yeah, it was really nice.
Now, other children are breathing easier too. Success with Roosevelt prompted expanded service at Children's Hospital.
We have actually started an airway clinic over here, which we do with pulmonology, which are chest specialists. And the bulk of our practice in that clinic are all these children who have complex swallowing as well as breathing issues.
God has just been so amazing, just with Roosevelt and just blessing us. He's a little angel. He's very, very, very good.
It's a strong combination, faith and the team at Children's. For Tiffany and Roosevelt, both can now breathe easier. At Children's Hospital, Heath Allen, WDSU News.